Assalamualaikum and a very good day everyone. I am Muhammad Iman bin Zamri from ED 2493B of Bachelor of Science Education, Honors Mathematics of UITM Puncak Alam. Today, I'm going to talk about dopamine. Many times we get up and go to the bed, get up again and go to the bed again. What is the meaning of life? Finding an answer is not easy when you see the suffering and the pain of people around you, the damage we do to each other. What is the meaning of life? In a dehumanized world full of emotions and devoid of feelings, the meaning of life is the engine that fills the soul. It is your true essence. It is your freedom that you can never take away. Your capacity to be. Happiness was distinguished from sadness by greater activity in the vicinity of ventral mesial frontal cortex length. Mild changes in negative mood appear to have little effects on cognitive control processes, while, while positive mood affects aspects of actualization, planning, and change. These cognitive effects may be related to neurochemistry, with positive mood effects mediated by dopamine, while the negative effect of mood may be mediated by serotonin level. Thus, every person needs to find the meaning of life. Since it makes us dream, sing, laugh, cry, and make mistakes to learn. Without this sense, it's just like we wander the world, but we do not live. From a neurological point of view, there are hormones in our brain associated with positive emotions, and one of them is called dopamine. You might have heard that dopamine is a feel-good neurotransmitter. In many ways, it is. Dopamine is a hormone associated with our happiness. To be specific, dopamine is strongly associated with pleasure and reward. Of course, it is not as simple as just that. In fact, there is a lot more to this complex chemical. Dopamine is involved in neurological and physiological functioning. It is a contributing factor in motor function, mood, and even our decision making. It is also associated with some movement and psychiatric disorder. So, what is dopamine? As I mentioned, dopamine is a type of neurotransmitter. Your body makes it, and your nervous system uses it to send messages between nerve cells. That is why it is sometimes called a chemical messenger. Dopamine is a neurotransmitter released by the brain and made in the brain through a two-step process. First, it changes the amino acid tyrosine to a substance called dopa, and then into dopamine. It affects many parts of your behavior and physical functions, such as movement, memory, behavior and cognition, attention, inhibition of prolactic production, learning, heart rate, and more. Dopamine also plays a big role in how we feel pleasure. It is a big part in our unique human ability to think and plan. This is because it will help us strive, focus, and find things interesting. So, when is dopamine is released? Dopamine is released when your brain is expecting a reward, especially in the morning. When you come to associate a certain activity with pleasure, mere anticipation may be enough to raise dopamine levels. It could be a certain food, playing games, shopping, or just about anything else that you are enjoying. For example, suppose your comfort food is a homemade double chocolate chips cookies. Your brain may increase dopamine when you smell them baking or see them come out of the oven. When you eat them, the flow of dopamine acts to reinforce this craving and focus on satisfying it in the future. It's a cycle of motivation, reward, and reinforcement. Now, imagine that you have been logging for those cookies all day, but your coworkers scarfed them down when you were sidetracked by a conference call. Your disappointment might lower your dopamine level and dampen your mood. It might also intensify your desire for double chocolate chip cookies. Now, you want them even more. So, there is an example on how dopamine works. Now, I will tell you about what time of day does dopamine is the highest. Dopamine levels are at the highest at 7 a.m. The level then decreases throughout the day. Thus, during this time, you can do some activities to boost the dopamine level again. There are many ways to get the right dopamine levels naturally. First, make a list of small tasks and then complete them. Even better, make those small tasks lead to accomplishing a big goal. Dopamine is released when you achieve any goals, small or big, but the strongest one follows accomplishing difficult goals. Second, eat lots of protein. Dopamine is produced from an amino acid tyrosine and phenylalanine, both of which can be obtained from protein-rich foods. Very high intakes of this amino acid may boost dopamine levels. That exercise often. Exercise can improve mood and may boost dopamine levels when performed regularly. For example, by performing 1 hour of yoga 6 days per week, significantly increase dopamine levels. Fourth, listen to music. Listening to music that you are enjoy release dopamine in the brain and send pleasure signals to the rest of your body, according to the researchers. And the more pleasing music is to the ear, the more intensely pleasurable the experience is for the body. Fifth, get enough sunlight. Sunlight exposure can boost dopamine levels, but it is important to be mindful of sun exposure guidelines to avoid skin damage. It is generally recommended to limit sun exposure during peak hour when the ultraviolet radiation is the strongest, typically between 10 a.m. and 2 p.m. and to apply sunscreen whenever the UV index is above 3. Levels then go up again in the afternoon and evening. The level of dopamine then decreases up until 10 p.m. Then progressively increase all night until wake up time. But lack of sleep can reduce dopamine sensitivity in the brain, resulting in excessive feelings of sleepiness. Getting a good night's rest may help regulate your body naturally dopamine rhythms. So, how does dopamine make you feel, especially in the daytime? If you get the right amount of dopamine, it will usually go along with a pretty good mood. Dopamine contributes to feeling of alertness, focus, motivation, happiness, and more. A flood of dopamine can produce temporary feelings of euphoria. Since dopamine is the main chemical in reward system, it is also the main neurochemical activated when drugs or alcohol are introduced to the body. Natural levels of dopamine are healthy and can provide safe mental functioning. But when there is too much dopamine, it is in the body, it can have a powerful impact. common effects of elevate dopamine include adrenaline, elevate senses, increased sociability, hypervigilance, and more. Once dopamine increase in the brain will go through a refractory period that can cause an individual to face severe effects. Some of the effects of minimal dopamine include depression, anxiety, fogginess, fatigue, neuron damage, and more. So, what are treatments for irregular dopamine levels? These chemicals are known as dopamine antagonists. These antagonists can block dopamine receptor and can help with addiction to drugs and alcohol. Common dopamine antagonists include many prescription drugs such as Seroquel, Risperdal, and Clozaril. Other medications can increase dopamine in the brain are known as dopamine agonists. Many illicit drugs are dopamine agonists as they increase dopamine level drastically. Some common dopamine agonists include LSD, methamphetamines, MDMA, and marijuana. Agonists and antagonists can help in the treatment of addiction of drug and alcohol. Research has found that it is not easy to adjust dopamine level after extensive use of dopamine high drugs. So, how long for dopamine receptors to heal? On average, it may take approximately 40 months to achieve normal levels in the brain with proper treatment and rehabilitation. Now, do you know that dopamine can save life? For your knowledge, this chemical usually plays a secondary role in the body, but in certain medical situations, it is literally a lifesaver. Doctors use prescription dopamine or inotropin to treat low blood pressure, poor cardiac output, poor blood flow to vital organs, and some cases of septic shock. There are possible complications with any drugs, even if taken under close supervision. The main ones associated with dopamine include irregular heartbeat, faster heart rate, trouble breathing, nausea, vomiting, and more. Because many drugs interact with it, it is important that your doctor knows all the medications that you take. So, that's all from me on the information of one of happy hormones, which is called dopamine. I hope this video can give you a new knowledge on dopamine. Thank you for your time. Bye.